I can see lots of people joining. This is John Huxmar from Digital Health. Lovely to have lots of you joining. I'll get us going just a couple of minutes once numbers have settled down a little bit. We have a fab 10-year plan webinar for you today, where the focus is with digital nursing and how it's integral and they are integral, nurses, to delivery of the aspirations of the 10-year plan. As I say, I'll be making introductions very shortly. Okay, it's Friday lunchtime. It is 12:30. Welcome to Digital Health's latest webinar in our 10-year plan series. The focus today is on digital nursing and how nursing, particularly digital nursing, underpins many of the aspirations in what is a very ambitious 10-year plan. I'm delighted to have some really senior people on the call today. We have Helen Balsden, no less, who is the National CNIO. Welcome, Helen.
Great to be here.
Helen also kind of has got a pedigree that predates kind of NHS England. She was CNIO at Cambridge University Hospitals, the most digital hospital in the country. So great to have you with us.
Thank you.
We also have Melanie DeWitt, who's joined us from North Bristol, where she is CNIO in an organisation that's going through some big changes. She might talk about that kind of later on. Welcome, Melanie.
Thank you, John. Good afternoon, everybody.
And then also joining us is Tremaine Richard Knoll, who is from our sponsors, Salesforce. I'm really pleased to have Tremaine with us. And Tremaine's going to be providing an industry perspective, and particularly the kind of help which some of the clients Salesforce is working for and the NHS are looking for. Welcome, Tremaine.
Thank you for having me.
Very welcome indeed. Okay, well, the usual kind of format for those of you that have joined us on previous webinars, I know many of you will do. We'll have a bit of a panel discussion, and we're encouraging you to kind of ask questions as we go. So for technical reasons, there isn't a separate Q&A tool. We're asking you to post your questions in the chat, and I will do my best to kind of fish them out of there and kind of ask them. Do respond to points that you agree with, things that you want to kind of comment on in the chat. We want this to be as interactive as possible. Well, I'll be putting your questions to the panel once we've had a bit of a panel discussion, and we'll do my utmost to get through as many questions as possible. Okay, so 10-year plan. It's still fresh. It's only about kind of 4 weeks old. What were your thoughts, and particularly the role of kind of digital nursing within it? Can I put that question to you first of all, Helen?
You know, as you might expect, I'm actually quite excited about the 10-year plan. I think it gives us a real opportunity, but it does require us all to give some time to reimagine how we give and deliver great care. You know, and I think that with the DASH review should actually give us a lot of levers and hopefully some new incentives to really reimagining care so we get people to the right place at the right time with the right healthcare professional. And I think that's something that's followed me throughout my career. Nursing is actually 2% of the UK workforce now. So we are massive. And it's really important that we are in a position we can make those 3 shifts and we use the whole of that community. You know, we hear a lot in this world about the analog to digital shift. We've still got lots to do. There's still, although many organisations are on that digital journey, there's still a few left to go. And even though they're on the journey, not all of the organisations have got all their processes digitised. But I think with what's planned for both the single patient record, the NHS app, you know, probably the 2 greatest things that are in there from my humble perspective. I think there's lots that we need to do to make sure we bring the wider profession to our work and really make sure that we can be in partnership delivering all of these changes. You know, for me, if we think about the role of nursing, it covers all sectors. You know, there's a lot in there about prevention. And actually the role of public health nursing is often forgotten, whether it's our health visitors, school nurses, so much is going on at an early stage. And how do we bring the connections from that piece right through to actually people, I'll take the obesity pathway. We're seeing people reach out for all these weight loss drugs now, but actually, what if we were doing something further on and can see the change in society? I think nurses are at the heart of all of those steps of the pathway. So great to see some opportunities coming through. Maybe unsurprisingly as well, if you've got as far as, I think it's page 100, because it is a weighty tome, isn't it, in the plan, you'll see reference to a CNO professional strategy that is being developed. Duncan has managed to get that into the plan, and this is a 15-year plan for our professions, and that is of course nursing midwifery and nursing associates, and it's for all places of care, so it includes the military as well as our independent sector, social care. And I've been privileged to be part of the advisory group that's met a couple of times now, and there is some fabulous thoughts and ideas, and really interesting to hear different sectors come to the fore as we start reimagining how we might deliver care. We've got some great leadership in the digital and technology work stream with Lincoln Gorbenzola and Dawn Dowding, because in all cases of the 10 work streams, there's an experienced lead alongside an early career nurse. So really starting to see this move forward and take everybody on a journey, because we know there's a lot of experienced staff that are probably more used to analog ways of working, whereas our early career staff are far more digital savvy. So I think lots of potential as we start driving it through, but we've got to equip our workforce. Simon and my team's doing some fabulous work with workforce training and education, looking at do we need from, that, what does it look like if we were to influence the NMC as they go through consultations on the code, revalidation, practice learning workshops, etc. So, but also the Digital Academy, looking what are the needs of the workforce generally to work in a digitally enabled environment, as well as the digital leaders. There's some work looking at how do we really harness AI? What do we need to know? And how do we step into that world? So we're developing an AI ambassadors network in collaboration with the other professions. There's already a great ambassadors network there, but really going, actually, if we're going to equip our workforce, what does it look like? And we've got an event we're planning later in the year, so excited to see how we can take some of that forward. And I think, we shouldn't forget we're innovators. That's what nurses do really well. We've been working with the NIHR Nursing Midwifery Leaders Group to put some academic rigor in some of the work we're doing, which has been a really interesting dynamic, and really starting to build the networks, add the credibility, build the evidence, so that we know we can push fast to really be at the forefront of designing different ways of working and making sure we can deliver on scale across all the many nurses that are out there. I'll shut up then, because I can go on forever.
No, I think that's a brilliant kind of introduction, Helen. As you say, there's a lot of stuff in there. It's a big document, Melanie, I wondered if I could turn to you next for, first of all, your overall kind of impression of the 10-year plan, and then what in particular caught your eye from a digital kind of nursing leader perspective.
Thanks, John. I am excited that Helen is excited, because I also was when I read it, and I completely connect with that idea of having to reimagine the future. It made me think a little bit about what I, as a practicing CNIO, was working on at the moment, and it's all about building an EPR, getting our paper forms into digital, trying to get the data out of it, trying to use it to drive quality and standardization, and to take the kind of cognitive load off our nursing colleagues so that they can focus on delivering great care within the sort of best practice framework. And when you look at the vision of the 10-year plan, suddenly all of that is open for question, isn't it? You can imagine this world where your ambient technology picks up your consultation and gives you back your care plan and takes your notes for you and gives you a list of actions and writes your handover and writes your transfer letter. And suddenly all the work that I am working so hard to do seems a little short-termist, although, you know, it's still really important we finish that work because we're not good to go yet, are we? So there is a real reimagining of the whole way that we work. And it's made me think about some of the human factors. So I imagine there are some colleagues on the call who are already taking in a sharp intake of breath, having just heard me say that. I wonder where we are with things like ways of knowing. So I've really noticed in my early forays into using AI, there's something about having to think about what I've just said and write it down that helps me internalize it and learn it and know it. And so if we are going to rely more and more on technology to do some of that thinking for us, how do we make sure that we're still critically thinking about the needs of the individual patient in front of us? I think that's going to be a real challenge for us, and potentially a whole different way of working. Synthesis is so important to knowledge. I wonder what will be acceptable to our frontline colleagues and to our patient groups as well. And I'm sure that that will evolve and change as they get more experience of interfacing with technology. I loved the focus on digital exclusion in the 10-year plan. I think that's so important. Nurses are advocates for every patient, whatever their individual needs or wishes are, and we need to keep that. And then I thought a little bit about the ethics of this. So I think lots of us will have heard Jess Morley talking about the digital representation of people and how we can get hung up on that and forget that there's a real person that sits behind the data. And I think we really need to keep that in mind as we work forward with the 10-year plan. And there's also a big question, I think, between standardization and innovation. So I'm sure Helen will acknowledge there's not very much in here yet about delivery. So it's beautiful vision of where we could be in 10 years, but the actual steps to get there are not clear to us yet, but I'm sure they're being worked on. And I wonder, you know, there's lots of opportunities to do things once, aren't there? And I can see the advantage in doing things at a national level and making sure that all our NICE guidance and our best practice and our evidence base is built into algorithms and decision making. But I also do wonder how we make sure that individual organisations still can innovate and try different things and evaluate those. So that's going to be a real tension for us, I think, moving forward.
Thanks, Melanie. Tremaine, if I could turn to you next.
Yes, sir. I'm probably going to echo some elements of that. I think I did look at it with excitement. I think that it's some of the thinking is a long time coming, as in it was, I think it's well understood that sort of moving to a neighborhood sort of model makes sense, but I think the clear shift in direction is welcomed. I think reimagining feels like the word for this. I think the thing that's really interesting at the time we're at now from a technology perspective is that the capability that is now out there and is growing day by day is significantly more than more capable than it was just 6 months ago, and therefore suddenly the question's almost like what does care look like, imagining no challenges around things like, you know, say workforce and this, but you've got technology that can now help do some of the tasks and processes. And I think that's the challenge, is almost the I think the getting the head around the technology is probably not the hard part. It's actually now looking at how do we, as I keep saying, we haven't been in the NHS left recently, but I think the challenge is sort of now thinking about the processes that are there. And I think the big challenge with implementation and change is often it's not being agreed like how things should be done before you start applying technology and other pieces. So I think the interesting thing is there's you completely step back and say, like, what is the best journey for a patient? How best does nursing fit in? And there's lots of potential there. I think the illness to wellness sort of approach almost here is again, I think there's it's a positive sort of drive. I think that the challenge is in the redesign of models of care and those side of things as well. I think like there's also what excites me is like the vision, but I think also there's a bit now around, again, that's already been said, around like delivery, but also sort of education, both in terms of like right now what is this, and also like catching up with, as people are entering into careers in nursing and other areas. Like, the world is changing quite rapidly. So, some of the things that Helen was saying are really positive to hear. And I think there's just a general, I'm seeing there's more of a willingness than I've seen ever for people in terms of adoption of technology. I think it's interesting to see, like, I think such a positive, whilst there's obviously challenges, positive adoption of AI across organizations. And I think it's setting the scene. So I think now, like, the more sort of collaboration and sharing of learning and learnings and best practice, I think is welcomed. But I think I agree as well around, there's a huge bit around empowerment, I think, to get this to get the 10-year plan enabled, because I think there's probably more, from my experience, there's more direction around governance than there is the actual goal of what you're doing. So I think, like, there's a bit of balance between that, what's the outcomes here around, for being really clear on those, and everyone almost pointing in the same direction whilst going on the journey. So I'd say that, that's fine.
Thanks, Dwayne. Okay, so beginning to kind of go into some of the main themes within the 10-year plan. So one of the big shifts is shifting care from hospital and acute settings into community. And as Helen already kind of called out, nurses of various kind of kinds, play a key role already in delivery of community services. So how can the nursing profession and allied health professionals and midwives, how can they kind of further drive this next phase? Because there's nothing new as a policy concept about shifting care into the community, but historically, those acute hospitals have been kind of very difficult to kind of shift services at scale out of, not through any fault of their own, but that is how we've structured our health service to date. So it's a really knotty one, Helen, but thoughts on how we can begin to kind of make that shift, and how nursing as a profession can lead on this?
They are really nutty questions, isn't it? And it takes a team. You hear me say that a lot, but we need big brains around this. I think I'm really excited about the potential of neighbourhood health. And I think nurses and AHPs have got a key role to play in there. There's such opportunity, but we've got to make sure we've got the right, I guess, infrastructure and architecture of our system in a digital way to enable data to flow. Because we commonly hear that community is the area that's been left behind. People going to people's homes, and we don't have the ability to enter data at the time. Things like ambient voice technology hasn't been tested in somebody's home. It's been tested in community clinics by nurses and AHPs, but there's more we could do to lighten that load and that cognitive load, I think. But I think it does come down for me about making sure we've got strong leadership and a strong voice across our profession, not just in the digital roles. We know community at the moment, about 63% of providers have got a CNIO, but very few of them spend 100% of their time on digital transformation like they do in the hospital setting. And I think unless we give those people the time and the structures to be able to maximise what we've got, we might be a step behind. But I think it's important that we go at different paces in different places. There's a commission that's out at the moment for different organisations to put some bids in for neighbourhood health, and I'm really excited to see what comes from that and how many of them have had a nursing voice in there, because some of those big things about how we shift to proactive care, how do we shift to managing long-term conditions differently, because people live most of their life in their own home, whether that's their own house or indeed in a care home, which is still their home. So how do we make sure they get the best experience, and we're adding, I guess, life to years rather than years to life in a meaningful way? And I think that's where nurses bring that credibility, their understanding of core care pathways, their ability to flex and be creative. But I think we need to look at our core infrastructure as well as our leadership.
Okay, great to see some questions coming in, which we'll come to in a second. Melanie, tending to kind of you next, in terms of kind of your thoughts on how digital nursing can lead that shift into community care in a way that really makes an impact, because clearly we've had past strategies. What are the lessons we should learn from past attempts?
So I would echo what Helen says. Some of the boundaries between organisations are really not helping with that. I think nurses are a collaborative profession. We like to work together, sharing data between organisations, particularly when some of those organisations are not NHS organisations, but they are part of our care providing team, is currently really challenging. The 10-year plan continuously says what great data we have. Population health data, yes. Individual patient data, maybe not so much. Much less sort of standardised use of terms. Very difficult to share data with colleagues in using lots of different systems. I think I was quite interested that it talks about the NHS app being a doctor in your pocket. I think there is something about how do we get a nurse, an advanced nurse, into the pocket of some of our care providers out into the community. So I wonder, for example, I have no data for this, but how many nursing home or care home readmissions or admissions could be avoided if we could put an really experienced nurse to advise the care team then and give them some reassurance in their setting about how to provide care for their patients rather than calling an ambulance. And I think there are definitely pathways like that we could explore, and there's a technological underpinning for that, isn't there? We have, if we use the wearables and we use the sort of imaging and we can do video conferencing, we could really wrap some of our inpatient nursing expertise, and this is definitely an acuteness lens on this topic, isn't it, out into support our community colleagues, and particularly those who are not in heavily nursing populated situations.
Thanks, Melanie. I should mention at the beginning, by the way, that unfortunately Emily Birch, who had been due to kind of join us, and she's a CNIO from a mental health trust, unfortunately had to kind of drop out. We were trying to have a more balanced kind of range of kind of nursing kind of leaders. I'm going to go to questions in a second, but Tremaine, first of all, in terms of that question to you as well about how can nurses lead that shift into community?
So I think there is something about this being almost a true era of transformation at the minute, right? So there's a need to sort of be bold and try completely different things and ways of working. I think the thing that's going to make this successful is sort of trying to make sure that any sort of those high volume, low complexity sort of tasks, administrative tasks that go on day to day, those are sort of eliminated by technology to be able to focus on the care side of things. And I think there's a danger with the current ways of working that almost like you put in lots of technology, but it creates more admin. So I think there's a side of creating those effective sort of processes. I think also the interesting thing here is, like, as you start to look at, and it struck me sort of joining as the technology side, is like the difference between a patient relationship management and a patient record management, as in one is looking at what information do we have, and the other's looking at, say, a timeline of everything that's going on with that individual. And I think that sort of way of working of a single view of an individual and an understanding of that holistic care needed, I think all of those things technology are going to need to be there to drive that. So I think like there's also probably a real partnership approach, I think, to get there with, the technology is moving fast, and I'm finding it fun. I feel like a kid in a candy shop in my role, where all the technology is there, and having been in the NHS kind of going, oh my God, there's so much that you can apply this to. So I think that there's a sort of synergy with the people in the tech space working with leaders and nurses like to basically help shape and show the art of the possible here. So I think that art of the possible bit is a huge thing, because I think we had at the summer schools, it was just seeing things like agentic AI up close and seeing how it can take on tasks was like a magical experience of seeing everybody just go, oh, I get it. We need this. We need it everywhere. Like, we've got so much. So I think there's a bit here of bringing people along the journey with technology. And I think the final point is that the change in today's sort of technologies is no longer like implementing a big EPR system. It's very much process driven and designed like coded up with individuals and outcomes in mind. So
Oh, you've just frozen for me, Tremaine. I don't know if that's for others. I'm going to say thanks very much. We're going to go to questions, and I'm roughly going to take questions based on how many thumbs up they're getting, which some are getting tons. I think the one that's leading at the moment is Jodie Fearon from University Hospitals of Derby. And Jodie asks, how will the community be supported with the extra focus on this shift? I'm aware they are also short-staffed, as are the hospitals. And how will this happen in reality? Helen, I'm afraid that's coming to you first of all, that one.
You know, I think that's the challenge that's coming out everywhere. We're in a perfect storm, aren't we? We've got a fabulous 10-year plan, but it's coming at a time when the NHS is being reorganised, and we're feeling it at every level. Whether it's at provider, whether it's here at the centre. And I don't think there's a perfect answer. I think it is about how do we collaborate together. And it is, as Melanie says, trying to break down some of the silos that are between organisations, because for a person, we want care to be seamless. We haven't all got vast pots of money to be able to do things, but we have got resources if we work together, and we might have got different things that we can learn from different parts of the sector. So for me, it's about collaboration, building the opportunities. And I think community is an interesting one. And I think they're at the heart of neighbourhood, because neighbourhood is so many different things, you know, with it being primary care, community care, social care, third sector organisation, independent sectors. I'm imagining some of the conversations that might be happening there, and they've got the power to be highly creative. So looking forward to seeing what they come up with, because it is teamwork and collaboration for me.
I'm going to put another question, Melanie, which is a variation on this, but really kind of pointing in the same direction to you. This one from Sarah Copeland. And Sarah says, our trust is already falling behind in even the most basic aspects of digital practice. For example, we cannot currently support simple functions such as sending text reminders to patients. And the rest of her question really highlights just how tough the environment is with vacancy freezes, restrictions on investment, and how difficult it is to sustain digital innovation in such an environment. And Melanie, as someone at a kind of, hardworking trust, any thoughts on that?
Oh, just huge sympathy. I massively recognise that description, and I think we have come from that place, Sarah. In Bristol, we're making our EPR journey. We are not by a long way finished yet. And I don't know that there is a silver bullet. I think we do need to wait a little bit and see what the delivery plan for this is, because there is clearly an aspiration to support organisations that are still early in their transformation journey. And I aspire, I hope that will support you. I think there is a great community of CNIOs. I have been in this role for 5 years now. I have had so much support from colleagues, and they have enabled me to get the right resource into business cases, make the right arguments, really amplify the nursing voice in conversations where sometimes it feels like it's a lot about money and data and performance. And so I really share your pain, and I just encourage you to keep in contact with the networks, reach out for a mentor, because I do believe that you and your organisation will get there, but I recognise that it's really hard when you're at the start, and sometimes it feels like the mountain is enormous and you just have to take one step at a time, which is easy to say and really difficult to do.
Thanks, Melanie. And Tremaine, I think it's the question I'd put to you is how to balance that kind of excitement about what's potential, and certainly the art of the possible is almost daily kind of growing, particularly with kind of AI, but the environment in which the change has to happen and transformation is required has never been more difficult. So as a supplier, how can you support organizations where they want to kind of make these changes, but the kind of pressures they're under can be kind of made that extremely difficult.
Yeah, so I think reflecting on some of the conversations I've had recently, it's often in the sort of design of those digital programs. What I mean by that is, there's lots of conversation around adding technology to current systems without actually addressing the root causes, like root cause of challenges. So, for example, as mentioned about sort of that admin process of having to, you've got a patient portal, but there's quite a lot of admin heavy bits within that. I think what I'm seeing is, when I'm talking to organizations, is almost like a need to look end to end, not just at a specific point, because actually lots of if not done well, it can add more workload. And I think that's the bit of making sure that actually it's not focused on just a point solution. It's about almost reimagining where can technology support and reduce the current burden alongside improving the future. So I think there's a really essential part in that thinking from the technology leaders when there are these new programs around, like giving the organization almost the right technology stack and set of tools to be able to kind of automate as much as possible in terms of some of the things that can be, to free up time for basically looking at new things and starting to innovate. So I think there's a balance there, and in the other part is really focusing on that co-design piece with staff, patients, wider stakeholders, carers, because I think in this, no one can be left behind, in this transformation. And I think that's key to making sure this is successful. The other part is probably around sharing. So, some organizations just aren't going to be in the best place to be that innovator, but they might be great to be a fast follower and have the learnings, use the learnings for others to help them get there faster. So those would be my initial sort of thoughts on it.
Thank
I
you.
think they're really interesting points, aren't they? Because I think tech is expensive. There is no doubt. We're having to make very tough choices. And I think there's something about how we take our executive colleagues on the same journey we are as digital leaders, and how we make the right choices. Rome was not built in a day. If I go back to my Cambridge journey, we knew the journey we were going on. It took us 7.5 years to reach digital maturity. That's not a quick fix, but you need to take incremental steps and invest at the right point, but not just invest in the technology, the people and the change piece, so that we really are using that digital transformation triangle to align the technology, the people, and the way in which they work. And actually steadily it builds, because we do know that digitally mature organization are more efficient. I think there's some statistics out that I read a couple of years ago about them being 13% more effective or productive and cost efficient. So I'm not quite sure the metrics were there, and I can't even quote my source at the moment, but that's quite compelling when we're in a situation where money is really tight. But our best bet is our people, and getting them there is something we need to invest time and energy into.
Brilliant. I'm going to start grouping a couple of kind of questions together. The first one is about skills. So this question comes from Chantel Hughes at University College London. And Chantel asks, is there a plan nationally on how to upskill both nurses and patients and the public? And then I'm going to bracket that with a question from Karen Hutchinson from South Tyneside and Sunderland. By the way, great range of kind of questions coming from up and down the country. And Karen asked, digital literacy skills of both starts and service users is very disparate and will be a factor in the success of the 10-year plan. So vital importance of skills, huge range of skills, need for investment. Helen, is that kind of digital workforce strategy ever going to see light of day?
That'd be nice. I think they are developing a workforce strategy as part of the 10-year plan, and there's lots of conversations about what elements in there are digital. And certainly the conversations I've had with James Freed and the Digital Academy, as I said, doing lots to understand what are the needs of our workforce. And they're not just looking at nurses and midwives, they're looking at everybody. And I think that's really important, because some of the early work is showing it doesn't matter whether you're a nurse, a midwife, a doctor, an AHP, a ward clerk, some of your core needs are the same. And if we can do that training on scale well, that means we don't have to do lots of silos specifics to professions. So I think they're working through what are the needs to then go, how are those best met and delivered? So really interesting to see where that goes. But I think the comment about how do we take patients or people on this journey? And I think for me, it is people, because if we're going to do prevention well, they're at the point where they're not patients. So I think there is something about looking at health and well-being as a longitudinal piece, but we do need to bring, some behavioral science into this. Just by giving comms messages isn't going to change somebody who doesn't want to embrace a healthy lifestyle. Do some exercise, eat well, stay hydrated. So we've got to do more with society very generally. We've done lots in the app space, I think, in terms of equipping libraries as a place in a community for people to go and try and navigate the app. And hopefully many of you will heard we've done some work with our maternity pathway, really trying to make sure that women can access information digitally while they're going through a pregnancy. And of course, that's just one small pathway. There's a need to make sure that everybody can actually access digital information or can be supported in a different way if that's not possible. We know 98% of homes have got an Android phone, but that doesn't mean that every person in the home does, nor does it mean there's enough Wi-Fi bandwidth when everybody's on holiday for everybody to carry on doing their work. So there's lots we need to do to reach society as a whole. I don't think that just sits with health. I think that sits across all of the government departments.
Thanks, Helen. Melanie, that's the same questions about the vital importance of training, digital kind of skills, both the kind of health professionals and the public, and I think that goes to some of the questions at some points you were making about digital divide as well.
Yeah, thanks, John. I think there are some things that would be helpful to do nationally. So I think that we would benefit probably in our local organisations some kind of standards around expectations, because I think a lot of us are trying to pick these problems up. If in my own organisation we still ask people about their numeracy and literacy at employment, but we don't necessarily ask them about their digital skills, and you cannot see your off duty or see your payslip now if you don't have some basic technical skills. There are some brilliant innovations going on across the country. I would give a shout out to Francesca Rees, who's a midwife in Plymouth, who's done a lovely piece of evidence-based work assessing the sort of core digital skills of her workforce. And there are some really good innovations. We have digital nurse fellows in our organisation who do at the elbow support for our nurses, and we've had colleagues coming in saying that they were going to leave their jobs because they were so intimidated by the software, and now they love their jobs and they're going to stay because of the intervention of those kind of people. And I think probably everyone on the call has something that they're doing in that space they're proud of. We need to identify that and share it. From a specifically registered nursing point of view, I think we collectively need to engage with the NMC and with our undergraduate education providers to make it clear what the requirements are. We know that this is moving really fast. If you're not in clinical practice on a day-to-day basis, it will be difficult for you to write the right curriculum to support our undergraduate nurses. And finally, I think data literacy. I noticed Laura's comment about data literacy in the chat. That's a real challenge for us. And I did some statistics in a module a number of years ago and thought I was fine, but it's moving so fast, it's quite hard for me to keep up. So I agree, we do all need data literacy in our core skill set, but we also need to support our nurses with the right support functions. I think in order to get the benefit of quality and safety data to drive improvement and to innovate in the way that we're all describing on this call, our nursing teams need the support of really skilled data scientists. And that is something that we know we collectively need to keep saying.
Thank you. Just before I come to Tremaine, there's lots of questions around kind of digital literacy and skills. There's one specific kind of question here, which maybe if I could put to you, kind of Helen, is so Jesse Gungor at Great Ormond Street asked, will there be national digital training programs, courses developed to support the education of clinical teams to utilize technological resources to the fullest, or should people not be looking to NHS England or Department of Health and Social Care, as it soon will be, but to the education sector for those types of kind of courses?
And I think they're always going to be, it's both, it's not one or the other. I think we're always going to have to rely on some things happening at national level that are fairly generic, though. They won't be specific to the technology that you might be using in your organisation. So there's always a need to make sure there's something readily available at the different levels, but education and training support to use what you have in place locally. And I say that because we can't solve everything with nationally. I think there's some generic skills, but we all get burnt out with the volume of mandatory training that we're doing, and there's huge amounts of online, and some people need that face-to-face or that interaction to learn well. So I think we need to look at different methods of education and training to support the different types of technology use, but also data use as well. So I think it's a mixed methods. But if you come back to the class data, and how organisation you can be satisfied with any stable EPR, but education and training is a core component. It's one of those big three pillars. But that's not just about EPR training for when you go live. That's about regular training throughout the year, and that's not something National's going to be able to achieve. That's about what support does your organisation put in, so that when you're making changes to your digital systems locally, you've got somebody that can just go, shall I just show you? What does that look like? Let's pick that up in training, or handovers of those opportunities. So we actually need a collective that's going towards this. Sorry, long answer.
No, not at all. I'm very keen on bringing in some more of these comments. I'll bring a couple, and then I'll bring Tremaine back in. So Laura Rogers says we need to, from Sussex Community, says we need to increase data literacy as well. With AI coming, it's imperative that nurses and other clinical colleagues understand the need for data quality. Another couple of comments have been around approaches to do digital confidence reviews within individual NHS organisations. That's something that was mentioned by Hannah Seld-Jones. So really kind of checking the pulse on people's kind of digital confidence and identifying kind of gaps. And one of the kind of posts in response to that is that something that could be supported nationally rather than the individual organisations doing it all themselves? And then there's been a clutch of questions around AI and how can AI innovation be embedded into the NMAP curriculum alongside national core competencies? That's Elaine Prosperini that asked that. And clearly this is kind of striking a note, AI, with Hannah Brown from Barnsley Hospital NHS Foundation Trust saying the nursing voice is not at the forefront of AI innovation. This is evident in the National AI Group. However, with a lot of nursing data all within paper and the lack of ability to share patient data within communities and the acute sector, how do we overcome such large challenges? So Tremaine, I know that kind of Salesforce very focused on agentive kind of AI and AI that can actually do things and take actions on your behalf. So in terms of the types of kind of understanding, skills, knowledge on AI and needs that kind of NHS clients are playing back to you, perhaps you could just kind of give us a flavour for what sort of things you're being asked for.
Sure, and I think that towards the end there's some really interesting sort of comments being made around, like, are we far off from almost AI agents being able to provide assistance whilst you're doing the activity? And I think that's kind of striking is a good example, actually, because I think there's two levels here. There's training so you have understanding of what it is you're using and generally sort of that, how to use it safely and those side of things. But actually there should be prompts and things you have as you go with technology as well. And I suppose the best example I can give here to help is, I've come over from the NHS to Salesforce, where we have our own, we use our own medicine, as it were. So, and I've just been blown away by being able to like build dashboards by asking an AI, can I find out more about this piece of information? And oh, I want to fill in this, I don't need to fill in a form. I can talk to something that will just do that for me and ask a question around like, what have you been doing in this space? And I think there is a bit of, with AI and other pieces around, there's so much it can do to help just the day to day and help almost guide you through. So I think there's a lot here that it can be done. I think also there's a lot around like I'm seeing here, lots of people are asking us things like, how do you use agentic AI to help reduce, answer questions around what time were appointments and then help rebook, I think, or there is a lot of internal things like, can you help summarize at the appointment, summarize the record, so you've got a key summary of the individual, or coming, like it's almost wherever there's admin, there's been an ask somewhere for around where it can be augmented. But I think the key thing with all of this is around that sort of like the data around this is important as well, in terms of having a good rich context of data around individuals, patients, etc. So yeah, I think at the minute there almost isn't an area where people aren't sort of looking at this. What we do is sort of help build, sort of almost starting those smaller use cases to say, like, let's build confidence in technology. Let's start small, show the value, and build from there. So I think, and I think a lot of it is around sort of explaining how easy it can be. So it's not too dissimilar to sort of training and sharing a set of instructions to a colleague, to say, this is what you need to do, this is what you don't do in this task, this is what I want to check. So okay. Yeah, quite a lot.
Thanks, Jermaine. I just want to bring in kind of Melanie and Helen. I think the kind of sense that comes through those questions, perhaps the common theme, is that nurses don't feel that they're got a seat at the top table on being consulted about AI, about kind of being involved in AI, and yet we know from the kind of feedback from the kind of CNIO network, huge amount of interest, huge amount of kind of involvement. So why that gap, and how to close it, Helen?
It's a really good question, because we actually document more than anybody, yet we don't have the data. And equally, when we do have data, we spend so long collecting our own data, we've lost the skills, if we had them, to analyze and interpret. And I think those are at the core of some of the AI pieces. And I think those are areas that we've been exploring with data and analytics, about how do we upskill our workforce so that we can actually harness some of those. And education and training is clearly a key part in all of this, but so's experience and exposure. We have had some places that have been available to nurses and midwives on the AI fellowship, but no successful applicants that have got through. So we are having conversations about how do we do this differently then, because we're really not reaching our group or reaching our potential. AI could change so much, but it is about, you've got to understand data, you've got to understand what's good. And I think we've got to really open our eyes and have some conversations about, where does AI come in? What does this look like? And see lots of questions in the chat about digital clinical safety as well. It's going to change what we do, because I'm certainly no expert, but making decisions about AI and its safety puts far more on the post-implementation surveillance, looking at what has the tech done, how's it learned, what does it look like? And for us, we need to come back to understanding data and that curious inquiry. Is it doing what we think it should do? Is this looking right? And those simple things that don't need sometimes a data scientist, although absolutely, they are absolutely critical to this, but somebody's clinical brain going, that doesn't make any sense, why is it doing that, are going to be absolutely pivotal as we move through into those digital ages. So lots more to do with education providers, setting the standards, and that's some of the foundations we're trying to get in place nationally.
Thanks, Helen. Melanie, the same kind of question there. Nursing is such a big part of the workforce, huge amount of interest and potential of kind of use of AI to support kind of nursing, and yet perhaps not getting the involvement that they should do at this stage.
Yeah, I think sometimes the focus is on reaching out to our medical colleagues, isn't it? But we have the potential, some of our nursing team have the potential to benefit from that. So ambient voice technology is already prevalent in clinic spaces. Lots of nurses run clinics. There's a huge opportunity for them there. I think the work around how you try that into community settings is quite early. They're doing some work in the Southwest in the primary care lab around how the AI copes in a kind of proper real life environment with the baby crying and the washing machine whirring and the dog barking, and how you get it to work. If that worked, then there's a big step there for our community nursing colleagues doing home visits, etc. I think it goes back a little bit to what I said about the outside. We need to decide what our tolerance is around what we will devolve to AI and what we won't, and what our clinical safety line is. And I think this is a conversation we're going to have to keep revisiting over the next few years. So at the moment, most of our safety cases say if you're using AI, the clinician must be able to check the work. And that's kind of what Helen's just described. When we look at some of the deep learning and the unsupervised learning models, the AI will be much more generative, and we won't necessarily be able to see exactly how it arrived at its conclusion. And so into that come all sorts of errors. Now, of course, people make errors. We bring our own biases. We overlook key bits of data. We don't always remember the thing that we needed that would have been pivotal to changing our clinical decision. So how do we take that approach into evaluating AI? Where is our acceptance of it making mistakes? What is it that we will tolerate, and how do we mitigate it? And I don't think we know the answer. I mean, I definitely don't know the answer, but I'm not sure that we've done enough of this work yet to have an answer. And I think we need to keep talking about it and iterating it and testing it, and keep that intense curiosity about, is this ethically right? Are we getting the right outcomes? Are we excluding people? Is the data that the AI is feeding us and the plans that it's feeding us right? Because that is the thing that will bring the best benefit for our patients.
I think it also comes back to there is a huge, we're talking AI, it's a huge hype cycle. The only thing that has made it to what they describe as the plateau of productivity is the AI that underpins radiology. And some of the pathology work. That's it. That's the mainstream. Everything else is new and innovative. Ambient voice technology, is probably the next big thing that's going to take the world by storm. Totally agree, Melanie. It could change quite a lot, but it's also about our clinical practice. When I listen to colleagues in the States, and actually, I'll come back to the UK. The UK just showed patient experience is so much better because there's eye contact. They're not looking around at the computer constantly. So the relationship was much better, but we don't write things down. And sometimes if we write it, we remember it better. But you still require a decision to check what the computer has captured and make sure it's accurate before you get in there. And certainly there's very little AI like that that's made it into inpatients. The US are starting to test some of the things, and they said it's been really helpful, but it has resulted in a change of nursing practice. Because as nurses, we're very used to going in to see a person, doing a set of obs and walking away and putting it in a screen. And they're going, for the technology to work, you need to talk it out loud. You can't just hold it in and then go and enter. So that's taken quite a cultural shift. And I think it's things like that we need to remember. They are saying their patients are better educated, and that's what's coming across. So we could actually be helping ourselves and those that we're caring with if we start articulating, vocalizing the care that we give, the results that we see, what we're doing and why. And that comes down to person-centered care and making sure, you're having great conversations and you're pitching what you say at the right people.
Thanks, Helen. I've been nudged a couple of times in the chat to kind of ask a question about clinical safety officers. So Rebecca Mellor from Manchester University Hospitals, thanks for your patience. Rebecca asked, how will we keep up with the demand of the shift from a digital innovation perspective when all of these implementations will need digital clinical safety documents, processes, overview? Digital clinical safety is supposedly everybody's business, but I heard many trusts left to the digital NMAP teams. We know our trusts cannot keep up. I feel disappointed how little digital CSO processes are mentioned in the 10-year plan. So clinical safety, the process around it, thoughts on that one, Helen? Oh, I've lost you. You're on mute.
Terribly sorry. There was a workshop probably about 3 weeks ago now that was led by patient safety, and there was a lot of digital clinical safety CNIOs in the room as well. And one of the big conversations is, why are we treating digital differently? You know, these are all systems that could impact the care that we give. So by nature, they are patient safety. But as a result of that, I think there is a desire to see things come together more fully. There is a really robust infrastructure for patient safety. And how do we build and share some of that expertise across the way? So the team have taken away some actions from that, really to look at what does good look like in this space? Because we could risk building an industry that's in silo and sits on a shelf and doesn't add for any value in a landscape where technology is getting more and more. So a work in motion being led by patient safety, but one that we're starting to influence because it's hard. We're all making tough choices.
Thank you. Tons of great questions. I can't remember a webinar with quite so many kind of great questions. And I'm afraid we're not going to get through kind of all of them, but let's have a blast for a few more. So in terms of some of the other kind of questions we have, then Rebecca Mellor, by the way, also mentions that she's on the Data and AI Fellowship Program. I think there was a mention of struggling to find people on that. So well done, Rebecca, there. Quite a few kind of posts also kind of talking, really kind of reflecting that, you know, the genie is out of the bottle on kind of AI, and examples of kind of nurses putting together policies, safety cases, or even data analysis and applications using the tools which are kind of now available. So, you know, again, to that theme of, it's not whether we want to do this or not, it's how we put guardrails and kind of safety kind of around it. And then there was another question back on kind of AI, which was actually kind of in the other direction, saying the concern around it actually might inadvertently de-skill nurses who are relying on knowledge sources that they access through kind of ChatGPT and equivalents, rather than through their training and their knowledge. So I just wondered if you might want to pick that one up, Melanie.
Yeah, so I think that's picking up on one of the things I said at the outset. You have to, in order to know something about a patient, you have to have some way processed it, don't you? And we see this even at a simple level with electronic observations. In the day where you had to manually add up your News 2 score, you knew it was a big number. Now we occasionally have occasions where the nurses kind of quite happily press the yes, I've read this button and not really internalize the fact that the patient is deteriorating. That's a really simple example. So there's some real human factors work for us to do here about designing workflows. And I think Helen gave an example of this earlier, didn't you, Helen? Designing workflows to make sure that you are bringing your critical thinking to the information that is coming from your AI, and not just seeing it as a task to be completed. It's how do we change our view of nursing expertise to being critiquing the information that the algorithms and the AI and the software is bringing back to us and saying, is that right for this patient? What does the patient actually want? You know, how do we this is the recommended care plan, but how does this fit for this real 3-dimensional person sitting in front of me? And I think it's going to be so important that we think about that as we move forward, because the opportunity to take out some of the bureaucratic and the sort of repetitive data entry is huge. But we have this track record in nursing of becoming more and more efficient but actually giving ourselves less and less thinking time. And I'm sure lots of older people on the call are already thinking about the shifts from 7.5-hour shifts to 12-hour shifts. We took out all that time when we could properly spend time with our patients in the search for efficiency. And we need to make sure that if we find efficiencies from the use of technology, they go back into patient care. So that would be my perspective, I think.
Yeah,
Thanks,
can I add to that? Because I think we've jumped straight to AI, haven't we? Because we are, but some of the talk, we still got to recognise people are deteriorating while they're in our care. And I think that's where we could use the technology, even simpler technology, and I'll use the word simpler lightly, but that digital clinical support, we know some of the benefits that we are getting the people on the right pathways at an early stage. Sepsis management, I've seen 4 cases in HSIB really recently about times when we have misdiagnosing somebody as having sepsis and they have sadly died. Yet things like clinical decision support could help guide our thinking. We are supposed to hold hundreds of clinical policies and procedures in our head. And if we can use digital systems to hardwire those, make it easy to do the right thing. And as Melanie said, reduce that cognitive load and just go, oh gosh, yeah, I hadn't thought about that. Yes, that probably is right. It's not doing the job for us. It's just giving us that real-time nudge. So it has got the potential, done well, of helping us deliver safer care to those who we're in our care.
As I've said a couple of times, brilliant range of questions. We've barely touched on questions such as the technology underpinning shared records. I think it's a whole kind of another webinar. Thanks so much to the contributions of all of our kind of audience who've been making great posts and interacting with each other and exchanging kind of ideas. If you haven't done so yet, please do have a look at that chat. I think you'll find some kind of really useful stuff. I promised that we would kind of end up to schedule, which is now, because Melanie has a safety kind of meeting for EPMA deployment, which we better not make her late for. So to round things off, I'm going to turn to our panelists and ask them for concluding kind of thoughts. And I think put a flag down here. We're going to have to run, I think, a couple of follow-ups on this because we've barely scratched the surface today. So first of all, Melanie, would you like to kind of go first? Your thoughts of the conversation today?
Thanks, John. Such an interesting conversation. Really have loved the chat. So many great comments. I think for me, it comes down to we need to decide what we're doing collectively, doing it once across the NHS for England, and what we're going to innovate locally and share. And if we could come up with some cool things to start on that, I think it would give us a good step forward.
Thank you. Tremaine, could I call on you next?
Yeah, so I think for me, what struck me is the sort of the curiosity in this space and an openness to kind of consider and think about it, and really like it's just brought home a lot around the education need and almost support to help organizations get there. But no, it's been a great conversation. Lots of different, there's so much here, as you've said, like you could spend an hour on almost every question we've got.
Thanks, Tremaine. And Helen, if I could turn to you for concluding thoughts.
Thank you. I've loved today's conversation. The chat is just blowing me away. I've lost some of it, but this is all about people. That's what's coming through, and it's about how it adds value to what we do as clinical professions and enhances our decision making. But it's really important that we stay collaborating, we stay in contact as a community so we learn from each other. Smarter, faster together is something I've said before. And listening to this is absolutely where we go. And it's working across those organisational boundaries. So really excited to have been part of this. Thank you.
Well, thank you. Thanks to our panelists, to Tremaine, to Melanie, to Helen. I think it's been fascinating. But particular thanks one more time to all of you, the audience, who've joined and taken such an active part. It's been a pleasure. I'm John Huxtable. All it remains for me to say is thanks to everyone, and I wish you a very, very nice bank holiday weekend to follow. And see you again soon.
Thank you.
Thanks, everyone. Goodbye.
Thanks, everyone.